pulling back the sheet on a situation that has been festering for years, if not decades. This is the hidden face of healthcare. This is what we talk about when we talk about disparities in healthcare.
I think first and foremost, the one thing I would like to bring to everyone's attention is the fact that there are only 20 states in the United States right now that are sharing data related to the racial background of those receiving vaccines. This is something that needs to be immediately corrected. If we're unable to measure the number of people who are being vaccinated, if we're unable to quantify the disparity, it's very difficult to find a solution or a way of solving the problem.
Yes, we are seeing American Indian and Alaska Native people throughout the United States are contracting COVID-19 at rates 3.5 times that of our non-Hispanic white counterparts. We are being hospitalized at rates on any given week between 4 and 5 times that of our non-Hispanic white counterparts. We are dying of COVID overall at a rate of 1.8 times that of our non-Hispanic white counterparts. So when we hear terms like we're all in this together or everyone is being impacted, there are communities like mine that are being impacted very differently. We are not all in this together. We are not experiencing it in the same way. And, I've been asked the questions about why. I think what we saw in 2020 and what we'll likely continue to see in 2021 is a reflection of the outcomes of historical trauma. This is what happens when you steal land, when you steal children, when you steal language, when you steal culture. What you see then is a community with the highest rates of diabetes, with the highest rates of heart disease, with disproportionate rates of high blood pressure, with the highest rates of suicide among our youngest community members.
And I want to hone in that like our African American, our Latinx, and our indigenous people, Asian Americans, Native Hawaiians, and Pacific Islanders have also been hit hard by COVID-19, and like families across the country, the lives of our community members have been dramatically and negatively impacted by the pandemic. The experiences of Asian Americans, Native Hawaiians, and Pacific Islander communities are often left out of the national dialogue. For example, there is a high burden of COVID-19 related deaths among Asian Americans, and Asian Americans have the highest risk of hospitalization and death among any ethnic group. And I also want to note that Asian Americans have faced the dual pandemic of being subjected to increased instances of hate and xenophobia that has swept our communities across the nation because of false associations of the pandemic with Asians and other perceived to be of foreign or different descent. Asian American patients and providers are reporting that overt racism and xenophobia are a challenge on top of experiencing the fear of pandemic and the high infection rates within our community. Patients report fear for seeking help and other resources that may help them get the care that they need. And there is true fear and emotional trauma as a result of harassment on Asian American communities during the COVID-19 pandemic, and the stress that this puts, the mental health consequences that this places on our communities is going to have long-standing implications for health of Asian American communities throughout the country.
No one can guarantee that another wave is not coming. And as we saw in the prior 3 waves, it was Black and Latinos who were dying. And they need to be at the table when these decisions are being made, because if the decision is to reopen and that decision's repercussions involve the majority being minority, then they need to have a voice and something to say about that, I feel.
We are seeing our tribal leaders die. we're seeing our elders die. And in Indian country, when we lose an elder, it is losing knowledge and language that can never be recovered. It's like an entire library burning down. And we saw the world mourn a library burn in the last few years. That's what it's like in Indian country every time we see an elder die.
This is MLK Community Hospital. I have to tell you, when I read this article, my reaction was, wait a minute, this isn't MLK-CH. I will say the most shocking thing for me in this article was how this hospital had basically called for reinforcements, was trying to transfer their worst patients to tertiary and quaternary care hospitals. And they were told repeatedly, no, because your patients don't have health insurance. But they responded as well as you'd expect a 130-bed community hospital to be able to respond in the face, not just of COVID-19, but they're located in the epicenter of the pandemic in the county of Los Angeles, which is the epicenter of the pandemic in the state of California. There's only so much they can do. They were literally in the trenches fighting hand-to-hand combat against COVID-19. And when they asked for help, when they asked for reinforcements, it was concerning to me that this article showed that they were told no repeatedly when they tried to transfer their sickest patients.